area busuafo na ma be hia mo mo ankasa mo so fo hema nie Maame colors Maame colors dear me say edi ba ko so awa oni me de bia o de frɛ me yelili Afro-songtress me na dwuma de me di ho chia me na dwuma de my health checks saving lives with my honorable doctor, a handsome young man, Dr. Bobson Ateko. Papa na what to know che, what to know see what say. On na brabo ne wo sua bra mu fa de sua ho. E fa ya brabo mu menka health me boa ya pomuden me ma me kala de na de bibia we me oboa me ginam na so be ka kire o ya pomuden ho adesua kese na doctor mo onya de otwi ni so na on be correct me oboa and then say hia mo ma na gi bebre se na say hia mo na ye be ka yade bi ho asem yade a eno so say yade bi be ka ho ha bi yade a ha adwen na doctor say and then so o de ba be ye mo adesua na wa kire mo na obi ehun ne obeye abusua ko bi ena domme ena so masene ma metimi de dwuma de ebrewo steam limited ono so efan so wo yire anase adamfo anase eko no omotoso steam limited ko ne toso na steam record eka ho bi omobo me chidom omo number egu screen na se mesre se bomodi anefa na watime ene omodi enkita ho efa akwan yo adansie anyomtuo bibia for entertainment ho ene kwan yo ho de pinchen omo na omo so enya omwa Lily M Palace Event Center e was amanka say Jamestown mesre wo se bibia pesa wo yefa wo event wo bia no bomodi ane call Lily M Palace Event Center e was amanka say Jamestown e ho so na Golden Palace Hotel Limited omo so e wo bia opese wo do tito bia ye papa chese my friend home away from home sabio ekura fie baby a honye he bia local environment local home bomodi an the Golden Palace Hotel Limited Airport Salon na this season we almost say memfa baby pink madia tumfi say me ye abaya na o ka chime say me ya brewa oboa me ya abaya anti na me rock baby pink anti eni na free Airport Salon ho omadawo ma fa meti yo bia ho ka omonkra bata ne doso meti be bodi nyina nti na me se from number no screen so said be ya wo ye program bia wo pese ho ye fa wo be ko Airport Salon no so sama wo ti ho aye fair Lily's Bead Hub de omo ya ne ahwene ahodo ya madislesi ono mo ho ye fair omodi anse wo be fe Lily's Bead Hub from number no screen ase said the ya ombetimi aye omwa na onso aye kama na obi ehu onani agye menua a wo hwe me ne de bia mebusa osa question we na menim se wo anu yi pa empredo sen and one kasa sorry so called doctor hono akoye check up how many times how many times do you go for a check yourself without being asked or told to do so? But modi answer one kasa ba ye ho doctor wate. Ye one kasa wo health ho adamfo. Fa one kasa ho adamfo ne do ho. Na hwehwe video mu hwehwe wapom mu hwehwe ho na hese. Bibi etochia. Na quickly akohu doctor. Na wa ye further checks na bia bibi na ebesewa. Wa ankasa ye me hunu yankanka mbantem. Wise mbantem anka amedru me sei. Enti my health checks ene dwumadi aba se ebebo won kaye free say doctor ke kan sam no nyina akere wo wi a na wa kan akere wo se ne ebeboa wo ne se obetimi akoye check up and sample a waka se ye me hunu yanka anka medu me say and then ye be kan wasam tuberculosis na matu ne din se part 1 part 1 tuberculosis part 1 the part 2 no be bremu na ye doctor papa wa hia de se the medical yaka no mere bia o wa ha sei mere bia o ne me na wa ha o kan maame ho na o ye enchiremu efa yade ho tuberculosis and a doctor say obeka ho asam Dr. Ateko Me mo akwaba.
That's fine.
And then so me da ase. So they will say ayoyo. And I know mre bebre. If you say yeah, part 1. Tuberculosis discussion part 1. Tuberculosis ayarebe.
Okay. So once again, thank you very much for the opportunity.
You are welcome. You are welcome.
So tuberculosis is a respiratory tract infection.
Respiratory tract infection. Okay.
Yarea affected respiratory tract.
Okay.
And I say the system now all body now so
okay.
basically the airways, the trachea, and the bronchioles or lungs.
Okay.
So most of the time that is where it affects. But it can extend to other parts of your body to cause what is known as the extrapulmonary TB. TB are affected with breathing and our lungs or airways. You're from the pulmonary TB.
Okay.
They are extra or extended away from your respiratory system, and you're from the extrapulmonary TB. And bacteria is a bacterial infection caused by the bacteria known as the Mycobacterium tuberculosis.
Mycobacterium tuberculosis.
Mycobacterium tuberculosis.
Okay.
And then bacteria are causing TB. Most of the time, like there are other species that causes other conditions that's similar to the TB though, but the TB, actually like typical TB, is caused by the Mycobacterium tuberculosis.
I see. And bacteria.
Yes.
And and Mycobacterium tuberculosis. What is the leading cause of tuberculosis?
Okay. So for tuberculosis, as I said already, caused by this bacteria.
Okay.
Most of the exposure is by when you get into contact with someone with active TB. So there's active TB and then latent TB.
Okay.
So you can be in a latent phase. So if you have latent TB, you may not have any symptoms. You are not contagious. You can't give it to someone or anything.
Okay.
And then most of the tests will test negative. Your X-ray will even be normal.
Okay.
But the only test is the skin test. They call something the tuberculin skin test. That's the only one that you test positive for. But for latent TB, you can't transmit it to anybody. But for someone with an active TB,
okay.
So if you are in close contact with someone with an active TB, the likelihood of you contracting TB is very high because usually it's from their respiratory droplets. So if the person, as I'm talking to you, I'm bringing out some droplets. When the person sneezes or when the person coughs, the droplets that comes out. So if you inhale some of these droplets, then usually you get infected with the bacteria. So usually close contact with someone with an active TB. So you can probably be a caregiver or someone you may not even know that the person has TB, and then you're in contact with that person. That's usually the leading way that people, the most ways that people get contracted with it. Sometimes the healthcare workers that work closely with such patients to get it. So ideally, when someone is diagnosed of TB or suspected of TB, you're supposed to be isolated. So at the hospital setting, they have isolated wards for TB patients where they keep them because it's highly contagious. It can easily be transmitted from one person to another. So one way, one of the easiest way to contract TB is by close contact with someone who has the bacterial infection.
I see. It is obi enya bi na me ben wo fia. You know, she said me eligible to contracting the disease.
That if a person has the active
TB now if we back on the friend saying latent na it may develop active TB no. How does it happen like that? So many latent na better na me develop active TB because I need be kumi I don't know.
No. Latent one there like you have the infection but there are no symptoms. You may not even know. You may not even know you have latent TB. So there are a lot of people walking around with latent TB.
And you
can't
transmitted it to
so for latent TB is not contagious. So you can't transmit that one. So that one you won't be ill. You'll be normal. Just that if you are to do the skin test, the tuberculin skin test for you, and then you test positive, there are some medications that you can take to prevent the latent TB from developing into an active TB.
Exactly.
So if you do the skin test and then it's positive, you give you medicines to prevent you from developing into active TB.
Okay, but active TB I know it's contagious and it's deadly.
Yes, it's deadly.
It can easily kill. Oh, I see. See, now that is where I was point to say, a better than prevent me from say now me who say menya TB is latent.
It's latent.
My friend say it's latent, but I'm trying. What can I do to prevent it from developing to the active TB? No.
So for if you test positive or you're able to test positive for latent TB, the first thing, the most important thing is to start the medication. So they put you on, usually it's just one medication, maybe isoniazid. So you take just that one medication, you take it for a while. For usually in children, you take it for up to about 6 months. Adults, you take it about 9 months. So you just be on that medication, and then that medication will prevent you from developing into active TB. Another thing that I can do is that usually TB occurs in immunocompromised patients, people with reduced immunity. So you try as much as possible to build your immunity by appropriate dieting, regular exercising. Do you understand? Ensuring adequate a good lifestyle. So exercising to ensure that you have adequate BMI, taking some dietary supplements to ensure that you are always healthy, eat well, get adequate rest. It's very important. Adequate rest to ensure that your immunity is very strong, so that you can easily fight off the bacteria.
I see. So if I do this, then make me protect me from
getting that.
Now I want to dwell on the active TB because I know I hear the the member call and many abreho. What are the signs? Maybe who say no active TB, right? And what I should do.
So, thank you very much. So for active, if we have the active TB, that's already there's pulmonary and extra pulmonary. Pulmonary means your respiratory system, basically. So for pulmonary TB, you begin to have symptoms that is mainly related to your respiratory system. So one of the major things you may see is cough. Productive cough. Productive cough means that you bring out phlegms. So you may experience a productive cough that will be persistent, sometimes even more than 3 weeks. So continuous productive cough for more than 3 weeks. Another thing too is that you may have blood in your sputum. Well, as you cough and spit out, you know that there may be some blood stain inside. Typically, they lose weight. They lose weight.
TB patients,
they can lose so much weight that you begin to see your rib cage showing up. So it looks like malnutrition. Sort of malnutrition is even a risk factor because when you are malnourished, your immune system is also compromised. So malnutrition is also so you look like a malnourished person. So usually in low-income countries, where poor countries, war zone, they're very young children. You see them very lean, malnourished children. Most of them test positive for TB too as well, because malnutrition is a major risk factor. So one of the things that you notice is that you lose weight. So you drastically begin to lose weight. So typically, if you see people like when you are losing weight drastically, like unexplained, and you are coughing consistently for more than 3 weeks, you begin to see blood stain in your cough. When you cough, you see blood in there. There's tiredness. You easily get tired, fatigue. There's fatigue, tiredness, that kind of thing. And then generally you feel unwell. You feel unwell because of the active TB infection. So basically, those are some of the symptoms that you get from the pulmonary TB. When it becomes complicated, when it extends to extra pulmonary, usually typically it can affect your neck and then your vertebral column, that kind of thing. So when it affects your neck, you begin to see some swellings on your neck. They call it scrofula. So scrofula, you see swellings on your neck. TB can cause that too as well. TB can disseminate into your brain because TB meningitis. TB meningitis, you know, like you have the confusion, hallucination. You begin to get the CNS symptoms too as well. When it affects your spinal cord, it makes your bone very weak. Sometimes it can deform, it can cause bone deformity. So your back
TB.
Your back can turn like in an S shape, that kind of thing. So your vertebral column can be deformed. So that is, they usually call it Port disease. The Port disease. So that is TB of the bone, right, and then the joints, especially the vertebrae, the vertebral column. So that is usually when it becomes like extra pulmonary. So usually it starts pulmonary and then extends to extra pulmonary, that kind of thing. So those are some of the things that you notice when they're having the TB. Yeah.
I see. So me notice sir nyoma ya wo kan ya. What are the steps are me take?
Okay. So thank you very much. So for TB, the management of TB, TB can be cured. TB can be prevented and then cured.
It can be prevented and then cured.
It can be totally cured.
So there's cure for TB.
There's a cure for TB.
Okay.
So TB. So the good news about TB is that it can be cured and then it can easily also be prevented as well.
Okay.
So what you do is that when you notice that you have TB, and then the good thing about TB is that the drugs for managing TB, they are program drugs. So when you say it's a program drug, it means like they are for free basically. You don't pay for your TB.
Oh, you don't pay for your TB medication.
No, you don't pay for it.
Oh, so they are all... know that? Okay, now you know.
So they are free, just like the HIV medications. They are program drugs that you get them for free.
I see.
So once you have these signs and symptoms, you quickly go to the hospital. The district and the regional hospitals usually they have the HIV TB clinics. Usually they combine that clinic together.
Oh, okay.
So the HIV TB clinics, when you visit the HIV TB clinic, they will start doing the test.
Okay.
So there's a sputum smear test. So they may ask for your sputum. What can I say?
Phlegms.
Okay. Right. They are tested as sputum smear. You may also request for a chest X-ray. You also do a chest X-ray. Maybe some of these tests you probably have to pay for some of these tests. So the chest X-ray, and then maybe if they have to do the skin, and there are other line probe tests and other things that they have to do to confirm it. So for the diagnosis, you may have to pay for those ones. But after you've been confirmed, the medications are for free. And then these organizations, the WHO and then the other organizations, sometimes they give out free foods depending upon which region you find yourself. There are certain foods, because more nutrition is a risk factor, they give out certain free foods that are very rich in nutrients to TB patients. So for a TB patient, you can get free drugs and free food, very nutritious food, especially those who are malnourished. Because adequate nutrition is very important in the management of TB. So the drugs are for free. You just have to go to the HIV TB clinic and then get the medications. And then sometimes, depending upon the region that you find yourself or the period, you may be lucky to get some free foods that you eat that are very nutritious too, that you can be preparing to eat. So TB usually coexists with HIV because of they said usually occurs in immunocompromised patients. So usually one of the major cause of death in HIV patients is due to TB.
Oh, okay.
Because TB is one of the major opportunistic infections that you get when you have HIV. So when you get one of the major, so HIV usually doesn't kill people, like the opportunistic infections that you get after you have HIV, that's what usually kills you.
Oh, I see.
So TB is one of the major opportunistic infections that you get when you have HIV.
Okay.
So TB, so usually people with HIV tend to get TB a lot. The tuberculosis infection too, a lot, as an opportunistic infection. So that's why they run their clinics together. They have the HIV TB clinics. So usually when they come, they also screen you for HIV to make sure that you do not have the HIV virus also.
Oh, okay. So you do have screening in Ghana for tuberculosis patients.
Yes.
Can you give us a brief on
that's I said already. If you begin to have these symptoms now, you go to any of the districts, the municipal hospitals. So depending on where you find yourself, you can go to any of the municipal hospitals, the district hospital, or the regional hospital. Or if you have a private hospital, so you can visit the private hospitals too. But you are going to the HIV TB clinic. That's where you are going to. And then you run. Sometimes if you are not sure, you can go straight to a hospital like the OPD to go and see the doctor, and then you'll be referred to the HIV or TB clinic for further management. If so be. So once you are diagnosed, if it's very severe, you may be quarantined or isolated in the ward, and then treatment to be initiated. Once you are better, so the treatment usually is, they give you about 4 drugs, like 4 tablets are going to take in, 4 different drugs you take. Usually there's intensive phase of the treatment and then continuous phase. So on an average for a normal person, you may do for about 6 months and then you'll be done. You understand? So for the first 2 months, you'll be taking the 4 drugs. That's the initiation phase or the intensive phase. And then for the rest, the 4 months, the next of the 4 months, you do just 2 drugs continuously. And then after the 6 months, you can be cured.
Oh, I see. So actually, it's curable.
It's very curable.
Oh,
very curable. But there's risk of relapse. Sometimes I can have relapse and other things. Just report back to the clinic and then so usually some people it can take up to 1 year, some people can take up to 2 years, but eventually you'll be treated.
Okay.
In normal cases, after 6 months, you're supposed to even get better after 6 months.
You are watching My Health Checks, Saving Lives, and of course with my Dr. Bobson Ateko, and I'm your host, the Afro-songtress Lily M. You can also call me Maame. So we talk about health. And then you can want some tuberculosis. Now tuberculosis no Dr. Maya nante say enya dia ebeku nti say uhu ni wakekan nyina symptoms ya wakekan wana say signs ya waka ho asemi say ohu dodo na ni eye wo no the doctor eken wan kasa hunu say e de ukosa atebe animu a na quickly na no na wakọ check your health na watimi aso anon tentem me sister afa na wabadwumade yi so a aha YouTube channel Lily MTV mesra dwumade ye dwumade bi a yeso ye de boa amansan na amansan ahwe ye health so ye na unni apomodem papa na unni nkwa eno nti wo hwe ye ode na ye ofe na wusuamu ade no. Then you also share it so that others can also benefit from this program. You don't just share it, you also subscribe this channel so that you can always be updated. The also be updated. Now also share a from TikTok, Lily MTV, and a Facebook, and so Lily MTV, and a IG, yes, Instagram, and also Lily MTV. In fact, all our social media handles, Lily MTV. Memfa enchia kese enchia from confirm my CEO honorable Doolittle Kwaku Sintim Aboaje osanso ya mi ankasa me ho kanfo ya mne ne bobra memfa enchia ne na se from confirm na memfa me crew members nyina so amadawroma. You are doing a great job behind the scenes. Your faces cannot be seen yet. You are doing a great job, and I say thank you for the support that you are giving the brand. Maame, aka Lily M. Doctor, me da se bebre. Na me busa question we say. Matete say ebinumu edru mpempenso obi a omunya TB omo fe moja. How true is this?
Okay.
Na odu sa atebe animu a na che say edwoko do he.
Okay. So usually there's a difference between say ofe moja and say obo wana mojeba.
Okay.
What I say, the typical sign for TB on fe moja per se, like obo wana na moja wom.
That's a perception.
So like on fe moja no. It's a ofe na but like usually so there's hemoptysis.
Okay.
Obo wana na moja de.
Moja wom. Okay.
And I say sometimes we flames are na moja blasting.
I think you even said it. Okay.
So that is typically of the TB. And then that is what happens like in active TB.
Okay.
So one of the symptoms of an active TB and it can be
it's coughing blood.
No. When you get that, I mean like don't be men born who say ube na baby sir. I mean like it's a typical symptom of TB.
Okay.
Once you initiate treatment on you and then you take the medicines. So usually to prevent one of the major risks of TB is resistance. Like there are lots of resistance. So there's moderate, there's mono resistance, poly resistance, and there's multiple drug resistance.
Okay.
So
mono, poly, multiple,
and then there's even extensively multiple drug resistance.
I see.
Because they don't need treating, because people are not taking it as it's supposed to be taken.
Okay. And
now usually the one ultimately developing resistance or mutating, they develop resistance against it. And there are lots of resistance. And sometimes when you get TB, you don't even know which ones you've got. You don't know if you are infected with the resistant ones or not. So now there are current labs, there are specific laboratories.
So the resistance, you'll be infested. Or infected.
The thing is that the bacteria that you are being infected with, because of the resistance, you've developed bacteria that some of them are called the superbugs.
All right.
So if assuming the bacteria that you have develops resistance to some of the drugs, when you infect me, you infect me with those resistant bacteria. Meaning that the resistant bacteria can also be spread. What I say? Only resistant bacteria no. One TB no any resistance, normal TB. The amount of normal medications now it work. But obi a multiple drug resistance. Now also so it can spread. So now the resistant bugs no has been spreading. What I say that is one of the dangers no.
Okay.
You see that is most of the potent drugs now you want no. After the treat cry
all right.
And so now you have to employ other drugs. Now there are a lot of drugs, but depending upon the type of resistance, sometimes the treatment may be difficult.
Okay.
That is why resistance is very dangerous right now. But now there are new laboratory techniques that you can even use to detect multiple drug resistant TB, and then which drugs the bacteria is resistant to, so that we can make changes. There are other drugs that are used though. But the most potent ones usually can develop resistance against them, and then I know it makes your treatment longer. So instead of the normal 6 months, you may have to be treated for about 9 months, 10 months, but you can still be cured. But I mean, like the resistance is one of the major health concerns of public health. Do you understand? They are trying to reduce the spread of resistant bacteria. So someone has TB, the person has to be quarantined appropriately to prevent the spread of this resistance.
That was going to be my next question.
Yes, you have to be quarantined, especially if you've confirmed active infection or suspect active infection. You have to be quickly quarantined to prevent the spread. And anyone who is close to the person has to be adequately masked, wear nose masks, and then keep adequate hygiene when you are taking care of the TB patient. You have to get special counseling. You have to be even giving you medication. If you are the caregiver, the primary caregiver of the TB patient, you have to start taking the TB prophylaxis. You have to take medications to prevent TB. You have to be on medications to prevent it. And then even sometimes the nurses who are in the ward with the patients will also have to be taking some of these prophylaxis medications to prevent the TB, especially if you have a lot of TB cases at the ward where you work. So that's one way that I can use to prevent some of these resistance.
So TB and asthma, are they interconnected? Or how are they related? Now, I feel my next question. So yeah, say me what TB. Now, my friends say me your TB. Me kuno asthma. How dangerous it is?
So for unlike asthma, TB is a bacterial infection, and it can be cured with the drugs, the anti-TB medications. Do you understand? It can easily be cured. But for asthma, it's not an infection. Do you understand?
So TB is an infection.
It's a bacteria. It's not an infection.
It's a bacterial infection. So asthma isn't
an infection. And then asthma, you cannot say can be cured. You can't give a definitive period say you can cure asthma
in 6 months. It can be asthma. Can be eternal. Can be like
it can be with you for
till you die.
The thing is that sometimes if you are well managed.
I just mentioned something. It can be with you till you die.
Yes, it can be with you till you die.
Okay.
It can
so
be
just manage it.
Yes. So sometimes, like depends on how you're managing. That's what I'm saying. I'm recommending some of these new therapies. And there are a lot of add-on medications. If it's well managed, over time you notice that the symptoms reduces. So as the symptoms reduce, your medication will also be reduced. So to get to a point that you have maybe just one tablet to take once in a while, or a inhaler that you be using once in a while. And there are people too from childhood, as they grow out of it. So there are a lot of patients that from childhood they had asthma, but as they grew up into the adulthood, they are not really getting it again. Some of them even after exposure to the allergen, sometimes usually use perfume. Even that now they can use perfumes and then they're fine. But I'll still recommend that you stay away from it as much as you can.
So the TB, you were on it.
For TB, for TB is a bacterial infection. You understand? And then usually occurs in immunocompromised patients. For an asthma patient, you are prone to some of these respiratory tract infections. So for asthma that is not well managed, you are also prone to getting some of these respiratory tract infections, such as TB. So that is like in severe cases, you can develop TB for an asthma patient. Because the condition puts you at risk of some of these respiratory tract.
So let me come to my next question, and it's a final question. What should I do? Manya TB nibi. My active stage. I'm with a family. What should I do to prevent them or to protect them from also getting personally? What should I do if I have it active stage?
I mean, very careful because TB is very contagious and it can easily transmit to your caregivers. So it's important that, especially like if you are someone that you need people depending upon the stage of the TB, if it's such that you need people to constantly taking care of you, then you have to designate some people, maybe 1 or 2 people who will always be taking care of you. And such people will have to start taking the TB prophylaxis, their medications.
I see.
And also, you have to be donning your nose mask or the PPE when you are attending to the patient. And then you have to get a separate room for you especially during the treatment, the first 2 months.
Okay.
Right, you have to get a separate. That's if you are not admitted at the hospital during that period. You have to get a separate room for you to be there, so that you don't get exposed to the other people.
Okay.
So as much as you should quarantine you in your own room, and then you keep you away from the other people.
Okay.
And then you can be regularly fumigating the rooms to make sure that you reduce exposure, since it can be airborne through the droplets. So you need to be quarantined, and then you select specific people to take care of you.
Okay.
In the treatment of TB, to prevent some of these resistance, we do what is known as DOT, directly observed therapy.
DOT.
Yes. So in the directly observed therapy, someone has to take the medicine and then make sure that you are swallowing it. So someone has to directly observe your therapy. So it can be a healthcare professional who will be coming to give you a drug. Usually some of the guidelines that came in Ghana that we should exclude family members, because sometimes the family members, they are a little negligent. Yes, but if contracting it. So, but if you happen to be, which is not really recommended, but if you happen to be a family member that is taking care of the patient, you have to watch the patient, make sure the patient swallows it. After swallowing, the patient should open the mouth for you to inspect to make sure that the person has actually swallowed the medicine. Because if you don't take it as it's supposed to take, you risk the development of the resistance. And that is also very dangerous. Right now, there are a lot of resistance, and then it puts a lot of financial burden on the government.
I see.
Since the drugs are given, they are programmed that has to be
given out freely.
Yeah.
Okay. I see. Adwumadie no, and asan so aye the yesua de me de mesua pa no nim se wo nua bi kunu bi bra bi obi a busuani bi na o TB a em say the doctor aka no enyina be famu aba. Doctor, your final words.
Okay, so some of the few things I can say is that TB is a very dangerous condition. We used to do a lot of TB campaigns and all. Lately I don't hear about it. Maybe I just don't hear about it, but I mean, like,
maybe you spearhead it.
Yes. So let's promote TB awareness. Let people aware of TB. We begin to get some of these same things that I've mentioned. Quickly get tested for the sake of your family, because it's easily contagious. You can easily spread to your family members, especially if you share spoons and other things at home, that kind of thing. So if you begin to get some of these, let's create awareness so that you begin to get some of these same things. You can get tested. Now there are several tests that can do to even detect resistant organisms. So let's get tested. If you are tested, you get isolated and get the treatment. There's a cure. You can be cured. Do you understand? So let's get the treatment, get cured, so that you can live long, harmoniously with our family members.
Yes, indeed, there is a cure. You can be cured. Dr. Kasapapa. And doctor, finally, one of my vitamin tips be you need
to boost your immunity.
Yes.
Like it's very important. So the immunity, you can dietary, without taking a dietary supplement, your food, make sure that you are eating very well to contain adequate or all the essential nutrients that you may need. So incorporating more fruits and vegetables into your diet. I talked more the other time about how to incorporate the fruits into your diet and the misconceptions around it. So if you look at our previous episodes, I'm sure you see those ones. So the fruits and vegetables, very important. Eating balanced diet, regular exercising, make it part of you. And then you can get some of these dietary supplements, because those ones, they have high concentrations of the nutrients or the vitamins, the minerals that you need. So get multivitamins, the one that contains zinc, vitamin C. So if you get zinc, vitamin C, this two combo is also very good in boosting your immune system. Vitamin C with zinc, or you can get the combo that may contain vitamin C, vitamin A, vitamin B, vitamin E. Sometimes we have CoQ-A, ginseng, the fish oils, you understand? DHAP. All those things help to boost your immune system.
Yes, I think that more health tips. All too soon, like I've always been saying, we've come to the end of this beautiful segment. Papa so said the makano. Na sa information ya doctor de mai enkwachire na obi anso nya so mfa so. Madam ase nya mam dam ase nya do madam ase say that's na ye besa na ehia. Bye.